My name is Bryan Williams. I'm a Professor of Medicine at University College London Hospitals in London. So guidelines are used to help doctors decide when to treat people with high blood pressure. Actually, in hypertension or high blood pressure, we have more data from clinical studies and observational studies that have taken place across the world for many years than almost any other clinical condition. So our decisions about when to treat patients are really grounded in quite solid evidence. What we say to our doctors about the treatment of high blood pressure is that we should consider treating anybody whose blood pressure is consistently above 160 systolic, that's the high number, or 100 diastolic, which is the lower level to which your blood pressure falls. And so this would require treatment normally with drugs, but at the same time also consider using lifestyle measures, particularly making sure your weight is in the right range and reducing your salt intake in your food and avoiding excessive amounts of alcohol, but drinking within normal limits is perfectly acceptable. It shouldn't affect your blood pressure. Now, in terms of if you do go on treatment, how low should we lower the blood pressure? Well, ideally we'd like to get the blood pressure below 140/90 in the majority of people with high blood pressure. Now, I said that we would treat high blood pressure if it was above 160/100. But the issue is we also treat some people with a lower level of blood pressure, and that's so-called stage 1 hypertension, when blood pressure is 140 or more, or 90 or more for the diastolic. Now, in those patients, we would consider treating them if not only they had high blood pressure, but some other condition that might increase their risk of heart disease or stroke, such as if they're diabetic, if they have kidney disease, if they've already had a heart attack or a stroke, or if they've got any other evidence of vascular disease, we would treat at a lower level of blood pressure, that's 140/90. Finally, I would say that in terms of the very elderly, and that's defined in guidelines as over the age of 80, we're more relaxed at the level of blood pressure at which we would start treatment, and that is 160 systolic, the top number. If your blood pressure is above 160 and you're 80 years of age or more and you haven't yet been treated, it would still be worth considering treatment, as we know it will reduce the risk of stroke. So they're the levels of blood pressure at which we treat. In terms of treatment itself, the drugs, that's become much easier. We use 3 or 4 major groups of drugs. There are very clear guidelines to the doctors about how to use these drugs. And if we use these drugs effectively, they're very well tolerated in most patients and control most patients' blood pressure very effectively.